Clinical depression is a problem that affects over 19 million Americans per year. Women experience twice the rate of depression as men. Symptoms of depression include little interest or pleasure in doing things, feeling down or hopeless, having trouble falling or staying asleep, or sleeping too much, feeling tired or having little energy, having poor appetite or overeating, feeling bad about yourself, having trouble concentrating on things, or having thoughts that you would better be off dead or hurting yourself in some way. Women may be more likely to report certain symptoms including anxiety, somatization, increase in weight and appetite, oversleeping, and outward expressed anger and hostility. Treatment includes antidepressants, brain stimulation techniques like ECT, and psychotherapy. Family therapy is also encouraged.
GAD is when someone is overly anxious and worries all the time, even if there are no stressors in their lives at the moment. This disorder frequently develops in childhood, but can sometimes develop in adulthood. It is more frequent in women than men. The most prominent symptom is worry, and headaches, muscle tension, exhaustion, restlessness, irritability, nausea, and sweating follow after that. This disorder does not usually interfere when it comes to social situations or workplaces. Effective treatment is to go meet with a mental health professional to engage in cognitive behavioral and/or behavioral therapy. Medication is also a good tool, although it only kicks in after a few weeks.
One in two women experience a traumatic event. Recent research findings have found that sexual assault trauma in women have similar effects to trauma in male Vietnam veterans. Although women are slightly less likely to experience trauma than men, the most common forms of trauma are sexual assault, childhood abuse, domestic violence, or the sudden death of a loved one. Once the trauma happens, 10% of women and 4% of men cope by either drinking, using drugs, or developing post-traumatic stress disorder. Symptoms of post-traumatic stress disorder in women include jumpiness, having a hard time feeling emotions, avoiding things that remind of the trauma, and experiencing depression and anxiety. Treatment usually works better on women due to higher rates of sharing feelings and emotions. One form of treatment is psychological therapy, which includes supportive psychotherapy, cognitive behavioral therapy, and exposure therapy. Other forms of treatment are medical approaches such as medicine to raise serotonin levels, changes in lifestyle approaches such as eliminating nicotine and caffeine, exercising regularly, eating healthy meals, and having adequate sleep.
OCD is when a person feels intrusive thoughts, also known as obsessions, and feels the need to carry out repetitive behaviors, also known as compulsions. Research shows that most people inherit the disorder. The two main symptoms are obsessions and compulsions. Obsession examples are fear of contamination, fears relating to accidents or violence, and sexual misconduct. Compulsive rituals include repeated washing or bathing, over-organizing, refusal to touch other people or items such as doorknobs, and etc. Treatments are usually antidepressant medications and psychotherapy.
Women are twice as likely as men to be diagnosed with panic disorder. A possible hypothesis as to why this is because of major life changes such as getting married or having a baby. People at risk must be cautious of their environment, genes, brain issues, and sensitivity to anxiety. Symptoms include shortness of breath, racing heart, chest pain, trembling, and feelings of choking and/or detachment. Effective treatment includes antidepressants, benzodiazepines, and cognitive behavioral therapy.
Sup, motherfucker?